residents along the Ofankor-Pokuase Road are grappling with a dense dust cloud generated by ongoing road construction. The air pollution is causing a range of health problems that have alarmed health experts. It is a problem shared by communities across Ghana wherever road construction is taking place. As Air Clean reporter Michael Ashali reports, community members are urging authorities to frequently dampen the dust road and find a solution to their predicament.
The Ofankor-Pokuase in Sawam Highway has become a dust-choked battleground, leaving residents and workers here grappling with air pollution. The stretch spans more than 30 kilometers and ferries thousands of commuters daily. After enduring years of a road plagued with potholes, this road rehabilitation has become a new inconvenience for the community.
So once they started this road, the dust is worrying us too much. It worries me when I dress up to go to work and I get to work. It seems my attire or my dress will be in a dead form.
Air pollution is a growing problem across the world, especially in fast-growing cities like Accra. Pollutants from vehicle exhaust, factories, and waste burning are sickening many Ghanaians and leading to nearly 30,000 premature deaths a year, according to the World Health Organization. Air pollution is a major cause of lung diseases like asthma and pneumonia, but it also leads to blindness, heart disease, stroke, diabetes, and birth defects. Roadworks here were badly needed. People had endured potholes that had made the trip difficult for years. The construction is expected to continue until December 2024. Roadworks like this are a problem across Ghana. In hot, dry months, dust kicked up blanketed communities around it, causing a range of serious health problems. Some that might be with people for life.
Over here, just in front here, we have some hairs in the nose that serve to trap particles in the air, particulate matter in the air.
Dr. Kwabena Ejenim Boaten works as a resident ear, nose and throat surgeon at the Kolibu Teaching Hospital. He says dust can be so small and so overwhelming that it gets into the lungs and bloodstream.
And then it goes on into the skin in the nose over here, this reddish part that you see. It's a place that has a very big surface area to help in conditioning the air, making it warm enough for the body, and it also serves to trap some of the particles that may have escaped from here over there. Now, in its attempt to do that, that is when, by contact with some of the allergens, then this nasal cavity, as in your nose, would react and be producing the itchiness that we talked about earlier, the nasal congestion, etc.
It's no surprise many people have chosen to wear a mask. Health experts say that's good. Masks are one way to reduce inhalation of dangerous pollutants. Reducing exposure to dust is also important, especially for vulnerable groups like children, the elderly, and those with existing health problems. Fise is one of many communities along the 30-kilometer road. Elvis Gadose is a heavy-duty truck mechanic here. He says on some days, the intensity of the dust makes it difficult to work.
I've been coughing, sake of the dust. As you can see my workshop here, my workshop is near the road, and there's a whole lot of the dust. And you can't be at the roadside and be working sake of how the road is. The dust is causing us a lot of tough time.
It's not just adults who are affected. Hegai Bamare is an expected mother.
That's why I always put on the mask. Because if I don't put on the mask, when I reach home now, my throat will be paining me. I have to take in some Mentos before I be up. But right now that I'm wearing the mask, I don't get that thing again. I don't have that effect again. The dust is too much. Sometimes you work
Haggai sells nose masks along the dusty road. She's not the only one made sick by the dust here. Experts say pollutants may pass to Haggai's unborn child, risking birth defects and lifelong problems. Haggai knows this, but she says she has no choice.
Always I go on for checkups because of my pregnancy. Always I go, they will be checking me, they say I'm okay. Sometimes I will be having a cold, they will give me medicine. But I can't stay in the house, like I have to come back still and work. And all is because of the dust.
At a nearby pharmacy, the severity of the impact on the people here is clear.
With sore throat, cold, and then cough. Some of them complain the dust because they sit in cars, they don't wear nose mask, so the dust goes directly into them. So they come, the place is dusty and all.
Angela is a pharmacy assistant. Since the construction started, she says they have witnessed an increase in the number of dust-induced complications in the area.
For now, it's just the cough, sore throats, and the cold that we see. But then, looking at a long period of time, it could lead to other complications. We tell them they should drink water more and then get a nose mask if they are around the area and it's dusty.
Dr. Carlos has been monitoring the impact of air pollution on Ghana's growing population. He's the program manager of the Occupational and Environmental Health Unit at the Ghana Health Service. He says the effects of dirty air are far-reaching for many groups of Ghanaians.
We know that the children, usually are more vulnerable because their lungs are not well developed, and they stay closer to the ground where you have some of these pollutants in higher concentration. So they are more vulnerable, as well as the aged, the elderly, who are also not able to handle the effects of this air pollution, as well as the strong adults. Then also, you can talk about those who have pre-existing chronic lung diseases, chronic obstructive lung diseases. These are exacerbated when they are exposed to air pollution.
The WHO estimates that 99% of the world's population is breathing polluted air. Children and the elderly are most at risk when exposed to these pollutants. And UNICEF is concerned, especially for children in Ghana. Dr. Emmanuel Chemantin Amoa is a health specialist with UNICEF.
If you look at pregnant women, it has an impact on them, on the developing baby in the womb, on when the babies are born. They may have low birth weight, some die, children have pneumonia. So even 50% of children who die from pneumonia, it is from air pollution.
Dr. Ejenim Boati warns that these residents face an increased risk.
There are some tumors in the nose that can be attributed to the kind of air that you've been exposed to. In the throat also, once again, depending on the kind of air quality, when you are dealing with periods when the air is so dry, carrying with it a lot of dust and other things, there are you are likely to have more infectious things happening in the throat by way of these things. So within this period, for instance, that we have a lot of dusty wind blowing around, there's a greater likelihood that you have some of these, some of the particles in the air making their way as far down into your lungs. For children, sometimes because of the inflammation that's going on in the nose, this back of the nose also becomes congested, and this back of the nose connects by a certain tube here that we call auditory tube to the middle ear, and once that allows transmission of germs from that back of the nose to the middle ear and causes infections of the middle ear. Yes, so that is one of the things that children are susceptible to.
The woes of some people are far from over. The dry conditions have worsened the situation. Analyst with the Clean Air Fund, Victoria Owusu-Teria, says the weather is expected to remain dry until the end of the month.
From research we found that during February, we have all reached the peaks and the peak of the harmattan. So mostly the dust levels, concentration levels are quite high in February. And then along the way, getting to the latter parts of February, it reduces.
Resident engineer on the project, Engineer Kwabena Bimpong, says they cannot be blamed for the dust pollution that has enveloped the area, although he admits they have challenges suppressing the dust.
In Harmattan, we all know that we have those issues. So to attribute it entirely to our project, I think it's a little bit, if it's not disingenuous, maybe it is stretching the issue too far. But then I acknowledge that we may also have had some, level of impact on the general environment. Before December, we didn't have any challenge. We were suppressing, dust. Dust is the major issue. We were suppressing dust with water, bowsers. But then sometime in January, we had a little bit of a challenge where a lot of our water bowsers failed us in terms of mechanical failures. And we resorted to employing the private tankers to help us. But that wasn't enough. So for about 2 weeks, we had a challenge with dust pollution. And of course, that coupled with the weather, because we are in the Harmattan season, and that really messed us up. Initially, we tried to have some other chemicals added to the water to reduce, and of course, to ensure that the water stays on the road. Unfortunately, we were not successful with those chemicals, even though they were expensive.
During our visit to the area, a water tanker was seen spraying water on the dusty road, but it doesn't do much. So this is the main road that leads to Amasaman, Pokwase and its environs. Well, there are efforts to try and rehabilitate this road and make it more trouble. But in the interim, the dust from the area is disturbing residents a lot. At this point, I have to wear my nose mask because it's very dusty in this area. A few minutes ago, a water tanker sprinkled water on this dusty road to try and reduce the quantum of dust that comes out of this road when the drivers ply it. Now, the road is wet, but it's only been 10-15 minutes and it's already drying up. The residents are urging authorities to consistently dampen the road throughout the construction process. Engineer Bimpong says that they are currently increasing the fleet of water tankers to improve the dust suppression measures.
We resorted to increasing the frequency as opposed to using chemicals that would ensure that the dust, is suppressed for a considerable time, and then without have to have that frequency that we envisage. So now we are increase it and increase the number of water bowsers. Now we have about 14, on the road. It used to be about 9 initially, but as a result of the challenges that we're having, we've increased it. We are continuously monitoring the air quality and when I say air quality, we are not only talking about dust, but then there are other greenhouse gases which are being monitored, emissions from our vehicles. And here I'm not talking only of our vehicles, but also generally, because when there's traffic, there's an increase in the greenhouse gases. So yes, we are looking at all of this.
This story was a collaboration with New Narratives. Funding was provided by the Clean Air Fund. The funder had no say in the content of the story. For Joy News, Michael Ashale.